Hi, my name's Dr. Jarratt Pytell. I'm an addiction medicine specialist and clinician investigator at the University of Colorado. Today, we're going to go over some tips and tricks on how to write a stellar abstract for the ASAM conference. A well-crafted abstract is an essential element to any successful submission for a poster presentation. In this video, we're going to cover what a strong abstract should do, walk through each component, share tips for clarity and flow, highlight some common pitfalls to avoid, and finish with a quick checklist to ensure your abstract is ready to submit. So first, your abstract is an important opportunity to quickly demonstrate to reviewers and the audience that your research addresses an important clinical or scientific question, and that your methods and findings are rigorous and relevant. A strong abstract should clearly state the clinical problem or research gap that you are addressing, explain your research objectives and aims, summarize what you did and what you found, and then share a key takeaway, what it matters to practice, policy, or future research. Let's break down each component. So the key components of your abstract should include the following. First, a title. The goal of a strong title is to capture the attention of the readers by describing the study. The title should be concise and informative. Next is the background. What is known about the problem or issue that you are addressing? Explain why the topic matters, identify what gap or challenge is being addressed, and summarize the existing research and data. Next is the objectives. What was the goal or research aim? State what you sought to accomplish, to learn, or to improve, and using specific and measurable terms. Next is the methods section. Here you want to be specific on what methods you use to accomplish your study aims. Describe what you did and who or what was studied. Concretely list the methods, data sources, and analysis. Next is the results. What did you discover? Tie the study back to these objectives and describe the patterns, outcomes, or insights. Finally, the conclusions. Here's your opportunity to relate what the findings mean and why they matter. This is not a restatement of the findings, rather a discussion of what the results suggest in the scope of your study, and an opportunity to acknowledge any limitations. Explain implications for practice, policy, or future research, and leave a clear takeaway. Let's now go over some tips for clarity and flow. You want to craft a polished abstract by making it clear, using concrete language, avoid vague phrases, define all acronyms, and proofread for grammar and consistency. Concise. You need to make every word count, and every word should add value. Flow. Ensure that each section transitions smoothly to the next, guiding the reader through your work. Next, we're going to discuss some things to avoid and some common pitfalls. First, avoid using stigmatizing language. Carefully review all terminology for appropriateness and consult the ASAM Words Matter documentation. Using too many acronyms or leaving acronyms undefined is difficult for your readers. Spell out all acronyms on their first use. Avoid using vague statements like methods will be discussed. Be specific and concise in what you did. Finally, avoid overgeneralizing your results. Ensure your conclusions are limited to the scope of your research. When you're ready to submit, it's good to go over a final checklist. First, ask yourself, have I included all the required sections in my abstract? Are the focus and objective of my work clear? Have I explained what I did and how? Have I shown what I found and why it matters? And have I met all of the submission requirements and proofread my work? I would like to end by just saying that a well-written abstract opens the door to sharing your research with a wider audience. By including all key components, keeping it clear, concise, and connected, and avoiding those common pitfalls, you'll give your submission the best chance of success. Use the checklist to ensure every detail is in place, and you'll be ready to confidently submit your abstract for review.